Medical news for the 28 million Americans who suffer from migraine headaches. New research says people with the severe headaches also could suffer brain damage. Dr. Alexander Mauskop is director of the New York Headache Center and the author of 2 books on headaches. Dr. Mauskop, thanks for joining us.
My pleasure.
Scary stuff, because we're talking about 1 in 10 Americans. They're already getting the migraines, which are bad enough, but now the suggestion that the migraine causes some brain damage?
Well, you have to consider the study. It was done in mice, and people are not mice. And the other important fact to consider is that we've known for a very long time that people who have migraine with aura, which is a less common type of migraine than the typical migraine. People with migraine with aura will have a slightly increased risk of strokes. But you have to take a look at the numbers. About 4 in 10,000 people who are healthy otherwise will have a stroke at the average age of a migraine patient, which is 20 to 30 to 40. If you have migraine with aura, that is visual disturbance preceding the headache, the risk goes up to 8, but still about 8 in 10,000 people. It's still a very small risk. We do recommend that people who have migraine with aura avoid other risk factors for stroke, such as smoking, reducing cholesterol, keeping blood pressure under control, exercising, and that will prevent the strokes from occurring in those patients.
So the connection between brain damage and migraines, you're not necessarily ready to buy that yet?
Well, we do have some evidence that people do have strokes more often, but every patient with migraine, or even patient with migraine with aura having brain damage, I don't think so. There's no evidence for that, and I don't think that will ever come out because we've treated migraines now for many years, and we don't see that in clinical practice.
Women are much more likely to suffer migraines. Do we know why?
Well, it's definitely hormonal influences, because until puberty, boys and girls have about the same incidence of migraines. But at puberty, girls begin to outnumber boys at the ratio of 1 to 3. But after menopause, women and men have the same incidence of migraines. So clearly, hormones play a role.
So does that suggest an avenue for a cure?
Yes, it does suggest some avenues for research, but true cure is probably far away, because the main cause, the underlying cause of migraines is a genetic predisposition. There's a very strong family history of most people who have migraines. So genetic cure is very far away, but that's the true cure.
Dr. Alexander Mauskop, thank you.
My pleasure.